Good afternoon. My name is Emily Haines, and I'm the Director of Public Health Initiatives at the Partnership for Maternal and Child Health of Northern New Jersey. Thank you for joining us today for a Facebook Live discussion on the topic of COVID-19 vaccination and children. Today, I am thrilled to be joined by Dr. David Levine, the Interim Chief of General Pediatrics at Atlantic Health System and a practicing pediatrician at Atlantic Medical Group of Scotch Plains. Dr. Levine is a board-certified pediatrician. He has consistently been named favorite kids doc by New Jersey Family Magazine. Thank you for joining us today, Dr. Levine.
Thank you for having me.
So my first question for you, Dr. Levine, is that this current cold and flu season has been really tough on parents with young children. We've had flu and COVID, RSV, other respiratory viruses, GI viruses, all circulating. What can parents do to help protect young children, especially those under 5, from respiratory illnesses?
So it's an excellent question. Unfortunately, there's not a lot that can be done. Most of these viruses do not have any vaccines that can be used to protect. And many of our children have to go to daycare or, be around other people. So there's going to be this spread of disease. And younger children are not very good at learning hand hygiene. So they tend to touch things, touch their faces, put their hands in their mouth and their noses. And so this is how things get spread. The best that parents can do is just make sure that when the children get home, that they make sure that they wash their hands with soap and water. If you have hand sanitizers around when you're outside or before they're going to eat, it's important to do that whenever possible. And keep your children, I know it's hard, but if your child is not feeling well, try to keep them home. Don't send a kid who had a fever in the morning on Motrin and send them to school where they can get someone else sick. And when it's necessary, take your child to see their pediatrician to make sure that it's nothing else that you need to be concerned about. But getting some of these viruses is important because this is how your body builds up your immunity as they get older. So that way, when you are in grade school, you don't get as many of these coughs and colds and sniffles because you've had a bunch of them when you were younger.
Right, and so some of those viruses are, those viruses that are going to cause those typical colds, symptoms that we see with is usual with young children. Some of these other respiratory viruses like flu and COVID-19, we have a way to prevent those, and they can be more serious. So can you tell us, out of the respiratory viruses that we've seen this winter, what are the ones that parents can prevent with a vaccine?
So the only ones that currently have vaccines are the flu vaccination and the COVID-19 vaccination. The flu vaccination is well known. It's approved for ages 6 and up. When it's your first time getting it, you get 2 in that year, usually about a month apart, and then you only get 1 thereafter. And the COVID-19 vaccination, depending on which one you get, if it's the Moderna, it's 2 vaccinations 4 weeks apart. And if it's the Pfizer vaccination, it's 3 vaccines broken up over, I believe, a 3 to 4 month period.
Great, and we're going to talk more specifically about COVID-19 vaccine during this conversation. In general, with respiratory viruses, what are some symptoms that parents, it might prompt a parent to call their pediatrician for when we're talking about a respiratory virus?
So the single most important thing is how the child is breathing. A lot of parents mostly make the calls based on fevers, but high fevers are not any different than low fevers. It's a common myth and a phobia that a child with 103, 104 is sicker than a child with a 101, when nothing could be further from the truth. The trend can mean something. How many days the child has the fever might mean something, but it really comes down to how is the child breathing. If you have an infant and that child is breathing very rapidly, you can see their ribs moving. They're tugging over here when they're breathing. They're not able to feed or nurse very well. This is a child who's in some distress. These are kids that absolutely should be seen ASAP. Other reasons would be that the child has had a fever now for 3 to 5 days. They're saying, if they're verbal, they're saying that their ears hurt. If they're not verbal, they're very irritable. They're not sleeping well. They seem to be motioning towards the side of their head. Or, as I always tell parents, if you just need reassurance or something does not sit right with you, you should always get that child checked out, because especially in a nonverbal child, you don't know what's going on. So I'd say half of my job is just reassuring parents that everything else is okay, as opposed to actually diagnosing exactly what's wrong.
Yeah, it's definitely important for parents to trust their gut. And, if something's telling you that you want to call the pediatrician, you're not sure your baby's not acting like themselves, that can be, a big a factor too. There's just something seems not right.
Yes,
It's always better to
absolutely.
get it checked out.
The person who knows best is the parent. And if the parent says to us, something's not right here, no one should ever say, oh, wait another couple of days and then let us know. They should say, okay, well, let's get you in and get you checked.
Right. There's so much information. Let's start talking about COVID-19 now, right?
Sure.
Because there's so much information about COVID-19 out there. As a pediatrician, what do you think is important for parents to know about COVID-19 and the vaccines that are available to prevent them in children?
So for me personally, what I wish and hoped that most parents would understand is that the safety of the concerns that they have about the vaccination are generally unfounded and are being fed by malicious actors online who are trying to get people not to vaccinate their children. There is more misinformation online about COVID vaccinations than almost any other vaccination that I could think of, which is kind of the way things are now when any new vaccination comes out. And that the safety of the vaccine is true. It was not any of the things that people have heard. There have been tens of millions of doses given, obviously more in the adult population, but millions upon millions in the in the 12 to 17s. And as you go down, still many have been vaccinated. And no one is hiding some statistic that shows that actually a large number of them were hospitalized or passed away or had something terrible happen to them. As a pediatrician in my office, we have vaccinated hundreds of these children, and I have not hospitalized a single one of them for anything to do with the vaccination. So for many parents, they just believe that COVID as a disease is not as dangerous as the vaccination, or they're more comfortable with getting the disease and what that might do to their child than they are with the vaccination. And I'm a parent of two children. One was under 5 when she was vaccinated, and one was 8. And I got them both vaccinated almost as soon as I could because I trusted the literature, I trusted what I was reading, and I will always believe that a body that is vaccinated, a body that is prepared to fight off an infection, does better than a body that is seeing it for the very first time without any protection for it. And we obviously cannot vaccinate against every single thing out there, but those that we can, it has been shown to prevent, if not the disease, then the worst of what that disease can do.
Right. And can you tell us more? What is the worst that can happen for children with COVID-19? Because you hear, kids do fine with COVID-19. What happens when a child, is infected with COVID-19? What can happen? It's typically mild, but
it
tell
is
us more about
typically
that.
mild. Absolutely. But children still die from this disease. And any child that can look, if the baby is under 6 months, there's nothing that we can do. All we could try to do in those instances is prevent it by protecting the family that surrounds that baby. But once you hit 6 months, your child can be vaccinated. And there was a study that was done from July of 2021 to July of 2022, and 821 children died. I don't know the specifics about each of those cases, but I would wager that some of them were either unable to be or were not vaccinated. And we do know that the vaccine prevents death. So the answer to your question is death is the worst thing. And I don't say that to scare people. It's the truth. The flu does this. Every single thing we vaccinate against, the reason is either it causes death or some terrible long-term disability like polio or measles or things like that. And the dirty little secret with all vaccines is, or vaccine preventable diseases is, the majority of people who got these things didn't die and they were okay, but we don't know who they are versus the kids who did very poorly, who were either neurologically devastated had to be hospitalized for long periods, or died. That's the reason that we vaccinate. We vaccinate for the common good, which means I vaccinate my children not only to protect them, but to protect my community. And we have certainly gotten away from this feeling that the community matters when we make a lot of our decisions. And instead, we think only about what matters to the family. Well, yeah, my kids are totally healthy. They probably would do fine. But you want to know what? Almost 50% of the kids that were hospitalized because of COVID had absolutely nothing wrong with them. So even if your child is hospitalized and goes home is okay, the anxiety that your child being in the hospital causes a parent and can cause a child, I've never understood why someone would be flippant about that, saying, well, they'll just be there for a couple of days and then they'll come home and they'll be fine. Go through it. Live through your child being in a hospital. It's not something you ever want to repeat ever again.
Absolutely. And when it's your child, it makes a difference.
Exactly.
So let's talk about children who have already had COVID-19. Do they still need to be vaccinated? They have natural immunity. They were sick, they got through it okay, and now they have natural immunity. Do they still need to get vaccinated for COVID-19?
I would say there we actually have a lot of good evidence to say the answer is yes, that a hybrid immunity is superior to either just going by natural immunity or even vaccine immunity. Obviously, I don't want anybody going out of their way to get COVID, but the immune system seems to do best when it's a combination of the two. I have had COVID, my wife has had COVID, and both of my children have had COVID. Fortunately, we were also vaccinated before we got it. And when it was necessary, we got our boosters as well. And our bodies are, at least statistically speaking, in the best position possible to have the mildest form of the illness, and most importantly, for what we know in adults, but we are increasingly seeing in children, avoiding long COVID.
Right. And you mentioned earlier about the dosing for COVID-19 vaccine for young children. It's multiple doses.
Yes.
There are different types of the vaccine. Both of them are mRNA based. Tell us more about what a parent would expect. So you've convinced a parent that's watching right now to get their child vaccinated for COVID-19. What can they expect when they take their child in for their vaccination?
So outside of one particular group, the side effects are pretty much exactly the same as any other vaccination that your child would get. The only sometimes strange things that have been reported are you can get an enlargement of your lymph node and your armpit, which I had and my son actually developed as well. There's a slightly higher risk, depending on which version you get, the Moderna versus the Pfizer, of possibly having a fever or having some irritability a day or so later. But otherwise, the side effects are fairly standard for any vaccination. The only group where there is some difference is sort of the pediatric age group. It's more 18 to 26, I believe. But the 12 to 17-year-old males, there is some degree of myocarditis, which a lot of people have heard about. The rates are definitely low, and you are 2 to 5 times more likely to have myocarditis from COVID than having it from the vaccination. But it is a real thing that we are still trying to figure out what it is that caused that. But what they have found is that with the bivalent booster, there appears to be less of that risk. And if you spread the vaccinations out longer than currently is done, you also decrease the risks. What is not known as of this moment is, does that change if you've had COVID? A lot of this was you never had COVID before and you got the Moderna or the Pfizer vaccination. I don't know if any of these numbers have changed if you are 12 to 17 and you've had COVID once or twice and then you're getting the vaccination. We do know that the myocarditis risk was a real thing. It has certainly in many quarters been totally overblown to the point where people believe that it causes even more damage. And again, people are hiding the real levels of morbidity and mortality that have been caused by it. But this is more misinformation that exists online. And again, comparing it to what COVID is known to do to the heart, the risks of the disease far outweigh the risks of the vaccination, and it has almost zero chance of myocarditis in the younger age group. So there was none noted at 6 to 4, and there is, I believe, very little, maybe 1 or 2 that I've read about in the 5 to 11-year age group. And we think a lot of it has to do with the dosing of it, but it does also have to do somewhat with the intervals between them.
Right, and my understanding is that vaccine-associated myocarditis with COVID-19 is often very short-term, very mild.
Yes. Yes, the expectation is full recovery. They have monitored some of these children over a year past that point, and they do not have any issues with their heart's ability to circulate blood, their stamina, the heart muscles, or anything. But I can speak from experience because I had a child who at the very beginnings of COVID had the multisystem inflammatory syndrome, and she's still on medicine to allow her heart to pump appropriately. So she was an example of a child who couldn't have been vaccinated, had one of the worst possible outcomes, is back to herself in school and all that, but she's still on a blood pressure medication.
Yeah, so the impact that you can have from actually getting sick with the illness is much worse than any rare side effect that you might get with the vaccine, which would be, if any, mild, short-term. There are no long-term side effects from vaccines. We know that with all the other vaccines too. We don't see long-term side effects from vaccines. So
yes, 3 years into this and all the vaccinations, these things would have been reported. This would not be hidden. There's real reporting of these. There's a lot of statistical analysis going on. Nothing is being hidden from the public.
Right. So let's talk about infants under 1,
yes.
Right? So this is babies that were born, I guess, mid to late pandemic, if you want to say out of the pandemic, I'm not sure yet. But let's say you have a child that's under the age of 1. Can they get vaccinated for COVID? Is it safe for them to get it? Should parents wait until they're older? What would you recommend?
So once you hit 6 months of age, your child can be vaccinated against COVID. Only 12% of children in that age group have actually been vaccinated, and an unknown number have already had the disease. The vaccines are safe. The uptake, as I just noted, has been very low. I do recommend it for the same reason I stated at the beginning. A body that is protected is going to do better than a body that is not protected. Do they have to run to the doctor or the pharmacy and get it as soon as a child turns 6 months? That's up to the parent. There are other vaccinations that are to be given at 6 months, and they might want to get those before they get the COVID vaccination. Right now, in at least our area in New Jersey, levels are some of the lowest that they've been in a long time. And some people take that as, oh, well, now I don't have to get it. Actually, now is a perfect time to get it because your child is much less likely to come in contact with it, but their body will be ready for whatever is coming, which we have already proven that we do not predict this very well. But whatever it is, COVID is not going anywhere. It's going to be with us. It's going to continue to cause disease, but we can help mitigate that disease by protecting ourselves, our families, and our neighbors and community.
Absolutely. And on that note, I'm a nurse and I chose to vaccinate my 2 young children who are under 5 for COVID last summer. And I felt really good about that decision for all of the reasons that you're mentioning, and also just for my own self to feel a sense of relief, that they would be protected from the worst of COVID-19. But there's still a lot of parents in New Jersey who have not yet had their child under the age of 5 vaccinated. What would you recommend to those parents? What's a last thing that you want them to take away from our conversation today?
Well, aside from hoping that our conversation would convince them to get vaccinated, I really wish that they would have a real conversation with their pediatrician about it. I often ask parents, is your child vaccinated? And if so, if not, what I'll present them is I'll say, is there anything that I can say that might convince you? As opposed to saying, how come, why not? Because I don't want to sound judgmental. I want to have a conversation. And unfortunately, most parents, they can't have that conversation. Or at least they can't seem to articulate to me why. We as pediatricians, we want to do what's best for children. I have always told my patients, I would never ask you to do something for your child that I would not do for my own. Just like you said, you got your children vaccinated, I got my children vaccinated. I do not begrudge anybody who chooses to not do it, but I try to use myself as an example to tell them, why would I do something dangerous to my own children? That just never made any sense to me. But I want to have conversations with parents. I want to try to either try to correct some things that they might not understand, or try to at least give them information and guide them in the right direction so that they might be able to get to the point where they can give their child the vaccination. But if we can't have that conversation, then I really can't do anything. So I hope what they would at least take away is rethinking about why they're not vaccinating, maybe doing a little bit more research at websites which actually give good information, like immunize.org or chop.edu, or even the CDC's website. And at the minimum, just talk to your pediatrician and see what they have to say.
Absolutely. That's great advice, Dr. Levine. And like you said, for those watching today, this is a great time to get your child vaccinated if they haven't been already here in New Jersey, because the levels are low and they can have some time to build protection up ahead of what comes next, which we don't know.
Right,
so,
exactly.
Yeah, thank you so much. That's all the time that we have for today for our Facebook Live. Thank you to Dr. Levine for providing this great information today. And thanks to our viewers for tuning in. To learn more about childhood vaccines and where to get vaccinated in New Jersey, please visit the Department of Health Vaccine Preventable Disease website at www.nj.gov/health or the partnership's website at pmch.org. Thank you so much and have a great day.